Glad to have you guys back today. We're talking all things testosterone. Today, I want to talk about the origins of why testosterone has received the possible adverse effect labeling of causing possible cardiovascular disease. For most people, when you think testosterone, first thing they think of heart attack, stroke. So, we're going to dig deep today into finding out why and how testosterone received that possible adverse effect labeling. So the myth, and I will call it a myth because a lot of the literature has supported the opposition of what people originally said about testosterone causing cardiovascular problems, stroke, heart attack. This myth was originally born out of three primary key points. Now, in 2014, the FDA had an advisory board meeting on the safety of testosterone. And the next key point was that there was a lot of public advocacy pressure on the FDA from external governing bodies or external entities. And lastly, there was speculation amongst medical professionals that if your red blood cell count goes up, then that means your blood's thick and that means you have strokes, right? Well, I've dug deeper in previous videos about how there's dozens of lifestyle and environmental and health conditions that can increase your red blood cell count, yet those don't cause strokes. So I mentioned on the previous slide that there was three big key points. And the principal key point I want to talk about is that a lot of the adverse effect labeling was based around an FDA advisory meeting. So in 2014, the FDA held what's called an advisory meeting. And what they do is they'll get along a panel of experts, they'll look at some literature, and they'll come together and examine the literature and see if there's any kind of risk versus harm, pros versus benefits on a medication. Now, in this FDA advisory meeting that occurred in January 2014, the FDA used two studies. That's it, just two studies. If you would want to label a drug as possibly safe or unsafe, you'd probably think they'd look at 10, 15, 20 studies. But this FDA advisory meeting, they only looked at two studies. And based on those two studies, testosterone received the labeling of possibly causing heart attack, stroke, and cardiovascular disease. Just think, changing the trajectory of a medication's labeling long term was derailed based off two studies. This would kind of be like saying your wife left you because you left the toilet seat up twice. Okay. Maybe that's a bit of a stretch, but you kind of get what I'm saying. Now, I do want to read the passage that was indicated on the labeling. All right. And it said the U.S. Food and Drug Administration is investigating the risk of stroke, heart attack, death in men taking FDA approved testosterone products. We've been monitoring this risk and decided to reassess the safety issue based on the recent publication of two separate studies that each suggested an increased risk of cardiovascular events. So there it is. A lot of labeling is based off of two studies, and that's how testosterone received a vast majority of its cardiovascular adverse effect labeling. I want to talk about the two studies that were used in the FDA advisory meeting when it came to labeling testosterone as possibly causing heart attack, stroke, and cardiovascular disease. In the first study, the researchers sought out to see what were the rates of all-cause mortality, strokes, heart attacks in two groups of men who underwent cardiac catheterization, that's go up in there, and they also had a testosterone level of less than 300. The first group has 7,800 men with a total T less than 300 who underwent cardiac catheterization and never started TRT. And the second group had 1,200 men who also had a T level of under 300. They also underwent cardiac cath, but they did start TRT. So again, both groups, total testosterone under 300. They both previously had a cardiac catheterization, and one of those groups started TRT. One of those groups did not start TRT. And the goal was to see if the group that started TRT had greater incidence of all-cause mortality, heart attacks, and strokes. Here are the results of the first study when they compared blood pressure and LDLs. So on the left side, I have the no TRT group, and their blood pressure 1 year on average, these are averages, post having the cath was 130 over 74, and 2 years post cath was 130 over 74, pretty much identical. And again, this is the no TRT group. And their LDLs post-cath on average, 1 year post-cath was 85 and 2 years post-cath was 85. Now, let's look at the TRT group because this is going to be the one that's bad, right? So the TRT group, their average blood pressure 1 year post cardiac cath was 129/73, and 2 years post cath was 130/73. So this is the group that's been on testosterone 2 years after undergoing coronary catheterization, cardiac catheterization. Their blood pressure is practically identical, hasn't changed at all. But cholesterol increase or testosterone increases your cholesterol, right? So the TRT group, 1 year after the cath, their average LDL was 83. 2 years after cath, their average LDL was 85.9. So let's say 86. So it went up 3 points. That's considered statistically insignificant. So no, at least per this data, testosterone did not have a statistically significant increase in their cholesterol levels and or their blood pressure. All right, we are now looking at the results of mortality, heart attack, and stroke comparison. So the no TRT group, 681 deaths, all-cause mortality, which is 0.08%. TRT group, 67 deaths, which is 0.05%. Okay. No TRT group, what's the deaths from, or how many MIs occurred? That's heart attacks, 0.05%. And the TRT group, 0.01%. Again, those are practically identical and very statistically insignificant. And strokes in the no TRT group, 486 strokes, 0.06%. And the TRT group, 33 strokes, 0.02%. So, yes, slightly more incidents in the TRT group, but still, we're looking at hundreds of a percent. We're looking at statistically insignificant numbers here. They're practically identical. Now we're looking at the second study that was used in the FDA advisory meeting. So the authors in this group, they stated that they selected PDE5 inhibitors, which are boner pills, because they share some similar indications to that of TRT. I don't know how they extracted that, but are boner pills really that much similar to TRT? Maybe, whatever. And they're conflating it. Anyway, this was a retrospective study, is what it was. And in this study, they followed two groups. Okay. There's a boner pill group, and then there's a testosterone group. And they followed both groups for 1 year prior to starting either the boner pills or 1 year prior to starting testosterone, and then followed them for another 90 days after they started the medication. And what they wanted to see was there any correlation between starting testosterone and experiencing myocardial infarction within that first 90-day period after starting testosterone? The authors concluded, here's what they concluded, that in those 65 or older, regardless of cardiovascular status, simply getting on testosterone increased your heart attack risk by twofold. They also stated that in those under 65 with cardiovascular disease, they too also have a twofold increase in having possible heart attack after starting testosterone. Let's look at the data in the men over 65 that have with and without established cardiovascular disease. On the left side, we have the boner pill group, and this is 90 days after receiving their boner pills. 13 cases of heart attack, which is 0.002%. Okay. Now, those 65 older without established heart disease, 20 cases of heart attack. Now, on the right side, we're looking at the TRT group. This is 90 days after being prescribed testosterone, and these are those with established heart disease. 8 cases of heart attack, 0.003% cases. Now, those over 65 with no established heart disease, 12 cases of heart attack, 0.002%. So if you look at the data from these two studies that the FDA used in labeling testosterone as having possible cardiovascular consequences, it doesn't appear to be very convincing that testosterone is actually a cardiovascular nightmare that the public thinks it is. In fact, new literature that's emerging is starting to show us that having low testosterone is actually worse for your metabolic and cardiovascular health.